Welcome to the Lyster Health Talks Podcast, hosted by Lieutenant Colonel Garrett Holt, the commander of Lyster Army Health Clinic and the Health Services Director at Fort Novacell. Each month, listen in as the team focuses their discussion on relevant, relatable content that empowers your health and the readiness of the force. Today's show focuses on mental health awareness. Join us now for Breaking Stigmas.
Hello, Fort Novacell. Lieutenant Colonel Garrett Holt here, the commander of Lyster Army Health Clinic, and I'm really excited to be starting our second episode on the Lyster Health Talks Podcast. This week is really special for us, really the whole month, because this month is Mental Health Awareness Month. So we're getting an opportunity to dig into that content a little bit. I'm really excited about our guests here today. I've got two of our rock star behavioral health professionals from Lyster Army Health Clinic. I'll let them introduce themselves here in just a second, but Lieutenant Colonel Adam Keller and Major Rachel Prokop are part of our team. Hopefully two names that you already know very well, Fort Novacell. But if you don't, then I'm really excited about the conversation ahead. All right, so let's dig on in. Again, Mental Health Awareness Month. And before we get to the content, I want to just quickly go around the room. If you could give us your name and a little bit about who you are and also what you do here at Lyster and for the Fort Novacell community. Colonel Keller, I'm going to start with you.
Hello, my name is Lieutenant Colonel Adam Keller. I'm the Deputy Chief at the Department of Behavioral Health. I'm also a psychiatric nurse practitioner.
Awesome, thanks. Sounds good. Major Prokop.
Hello, good afternoon. My name is Major Rachel Prokop. I am a licensed clinical and aeromedical psychologist, and I work in the Department of Behavioral Health.
Awesome. Major Prokop, how long have you been with us?
I've been with Lyster for a little over a year now.
Oh, wow. That's great. Yeah. That's awesome. And how about you, Colonel Keller?
It'll be 2 years in August.
2 years. That's exciting. I know you won't see it as many of our listeners will, but these are two smiling faces that you see in our halls. And then, like I said, many of you may have also had the great fortune of getting their listening ear as a patient as well as we drive into it. So this is a really important month. I think this month's focus is not just mental health awareness, but we're trying to reduce the stigma. I think that's a big part of kind of where we are as a society. I think, there's a lot of good points about, mental health is part of our health, and we want to get to a good place where, I would like to say that we're mentally wealthy in a lot of ways. Maybe if we could kind of dig in a little bit, and maybe you could each kind of give me your thoughts on, where do you think the stigma is today of mental health and seeking out behavioral health, and maybe some ways that we can kind of overcome that. Why don't we start over here? Adam, you go ahead.
Well, I've been in the Army 22 years, and like I say, we've come a long way since I've been on active duty. When we first started, we only had division mental health in most units, most posts, and now we have embedded clinics, and we have behavioral health teams embedded in each BCT. And here at Fort Novacell, we have our Department of Behavioral Health here to provide services for the clinic. So I think stigma is still there for sure. Access to care has improved. More resources are available now. Not just from behavioral health. We have some other resources we'll talk about today in our community partners. But that's something that we still deal with. One of the hashtag Stop Stigma is our actual slogan, for Mental Health Awareness Month, and we just want to normalize that it's okay to ask for help is also helping yourself. So just to kind of encourage people to get out and if they need some assistance, we're here for them.
Yeah, I love that. Normalize it. I agree. Certainly joined the United States military many years ago, and we did not have the vast array of mental health and behavioral health access that we do now. That's really integrated in all of our units. So I think it's certainly there, and I appreciate that. Rachel, what about you? Where do you think stigma is at right now, and where are we going, and what's available to us?
I definitely agree. It's still there. I've only been in for 7 years, actually today.
Yeah. Right.
But even in that short amount of time that I've been in, I have noticed that the stigma is not what it used to be even 7 years ago. Like Colonel Keller said, we're more active in units. There still is definitely some stigma, especially within the aviation community, just in the military in general, more so that, there's a stigma that if I come to behavioral health, I'll never be able to fly again. And even outside the aviation community, there's concerns that if they come to behavioral health, maybe they can't do certain duties, positions of significant trust. But that's not That's not true. You can absolutely come to behavioral health and you can still be on flight status and you can still seek mental health services and still go do those special duties like recruiting duty, sniper school, all of those types of things.
What's some resources that you've seen, Rachel, that we have here on this post that people may not be aware of?
Some of the resources that are available to active duty members, one is Military Family Life Counselor, the MFLCs. Each brigade has their own MFLC embedded within their brigade. They're not really necessarily affiliated with the military, but they can provide services for active duty members and their family members as well, actually. We also have Military One Source, so you can actually call the 1-800 number and they can get you connected to some free sessions off post. Chaplains are also a really great resource as well for service members. The majority or a lot of chaplains in the military actually have a degree in counseling, so they can provide not only the spiritual aspect, but some of that therapy aspect as well. And then us, too, we're another great resource, the Behavioral Health Clinic at Lyster.
Yeah, sure, that's great. And the Military Family Life Consultants, remind me, that what's their professional background? What licensure or certifications do they have?
So they have a master's level degree in counseling, like LPC, marriage and family counselors. So it just depends, but they have at least a master's degree in counseling.
Oh, that's great. That's great. Certainly. It's nice to have those professional aspects in a lot of ways. That's great. And Adam, we were talking a couple of weeks ago about, certainly there's professional aspects to engaging with mental health and really taking control. But is there also, you had some really cool thoughts about kind of that, what does that personal touch look like, either as a individual or as counterparts and as a community, and any thoughts on that?
Just getting to know our patients and spending time with them. We have a little bit longer appointments than most, other disciplines. We have our intakes are about an hour and a half. We have a half an hour follow-up. So when we're going to meet with a patient, we're going to spend some time with them and get to know them. It's not like going to your PCM. When you PCM, you have something you want to get taken care of. And they see, about 20 patients a day. So they really got to kind of run them through, make sure everything's addressed systematically. But, we really want to make sure that we give our patients a chance to talk to us, get to know them. And hopefully we plan to follow up with them. Usually we see patients at least monthly if they're on our normal panel. So just spending time and get to know people.
It's also very comforting for me to hear, not only as a entity within Lyster, but also a family member and a soldier, to hear that there's a personal touch to it. That's actually, much further than what I remember when I first joined up. Hey, Adam, what's some things that we can start to, if we're starting to take hold of our own mental health? Because I know sometimes we reach the end of our career, or we're at just a critical stage in our mental health. But man, there's probably some things we could have done a little bit sooner. Maybe not just a day, maybe a few years. What's some practices and things that you have for us that we could start to adopt?
A good thing to start is just kind of improving your sleep, because a lot of our patients, I'd say 70-80% of our patients also have sleep problems, maybe even more. People need to get about an average of 6 to 8 hours sleep at a minimum, preferably 7 to 8.
Sure.
There's some things that they can do, some sleep hygiene to help facilitate a little bit better sleep, set themselves up for success. We are creatures of habit. People need to be on a routine, not just during the week, but on the weekends. Set their room up, cool, calm, quiet, and dark, and cut out that if you're having trouble falling asleep, cut out that caffeine about 4 to 6 hours before bedtime. Just little things like that can improve your sleep. If you're sleeping better, you're feeling better, you're going to be able to manage your stress better, and have it be in a better mood. Because if you don't get enough sleep, or if you're hungry, you're going to be angry. So we want to make sure that you got fuel, you got sleep, and you got fitness. Back to the old Army triad, performance triad. You can't go wrong with that.
Right. Rachel, what do you think? Is there things that, particularly as you look towards our aviation population, we of course have listeners across, but we certainly want to address some of our aviators. What's some good practices that you're like, hey, how can we also implement, or is there things that we need to amplify that Adam provided for our aviators?
Definitely the stress management. That's probably a really big one, because especially if you think about it, like when they come in and they're going through through flight school, that's a very stressful time. And then when they leave and they go to force comms, they go to their units, typically cabs this day and age, they're very high op tempo. So making sure that they're able to, appropriately, manage their stress. So that is, again, like what Colonel Keller said, getting good sleep, making sure that you have good, healthy coping skills. So, a lot of times I tell people, sometimes you have to try something new because they're so used to doing the same thing over and over to help them de-stress. And sometimes that loses its efficacy, and sometimes you don't have that easily available. I have so many people that come up to me and they're like, I love to snowboard and ski. And I'm like, you're in the middle of Alabama. That's going to be a hard thing to do. So going out and trying new things and just seeing what works for you where you're at. So a lot of the things that apply to the general population definitely apply to the aviation community as well.
So Adam, I want to turn it back to you. There's a lot of capacity on this post to help with folks working through different mental health, either diagnosed conditions or otherwise, or they just need some help. But that capacity can sometimes get constrained, or we just might not have the specialty that we need on this post. So can you walk us through a little bit of what that looks like, maybe like how the referral activity works for our behavioral health team?
Yeah, for behavioral health referrals, you don't actually need a referral. So anybody that's a beneficiary can go off post, find a TRICARE affiliated provider and make an appointment. So it's not a requirement. They can go through their PCM. They can also have some assistance, ask us for assistance to facilitating that appointment or find out where they can go, where to look for. But it is not required. And we do have on a space available. We do see dependents and retirees for psychiatry on post here at Lyster. So and for substance abuse too. So it's not just active duty service members at our clinic. SUDC and psychiatry, we are seeing dependents.
That sounds good. Well, I want to start closing our time, but before I do, I want to give both of our guests here an opportunity to speak a few more resources. I think there's a few other things they want to talk about. Major Prokop, over to you. Any other things that you want to provide to our listeners today?
Yes, absolutely. I just want to let everybody know that if you ever find yourself in a crisis, the National Crisis Hotline number has officially switched to 988. So if you need help and getting connected, you can easily just call that 988 number.
Oh, that's great. 988. I love it. I love it. And Adam, Lieutenant Colonel Keller, what else do you have for us today for our listeners?
Don't wait. If you need help, we're available, or there's resources that are available for you. So we just want people to, if they feel like they could use some extra help, or maybe they know somebody else, ask. If you see something's wrong, say something. Back to the whole TARP. If you see something, say something. Make sure check on your buddy. So.
That's great. That's great. Well, Lieutenant Colonel Keller, Major Prokop, thank you so much for joining us today. Accessing mental health and behavioral health professionals is incredibly important, and also taking care of your buddy. I saw an interesting stat of about 44 million people in the world every given year are have some kind of mental health diagnosis or what have you, and only half actually go and access a professional. And that is tragic to know that there's so many, to upwards of 22 million that need that care. So I just challenge everyone on the line to if you know somebody that's hurting or something, there's plenty of resources that we provide here. We'll have more on our Facebook and social media that you certainly should consider. And of course, 988. If something gets to a critical time, 988, that hotline, I can't say it enough. 988 is a good number to take down and be ready for it. Hey, again, I thank you so much. This is such an important topic. I wish we had more time. Just want to thank our listeners again. If you haven't liked our Facebook, continue to follow our Facebook. The podcast is again on Spotify and Apple. So if you're trying to share it with your friends, there's plenty of opportunities. And I just want to thank you all again for listening and reminding you again that your healthiest chapter is ahead and the only way is forward.
The Lyster Health Talks podcast is produced by the Lyster Army Health Clinic's Public Affairs Office at Fort Novosel. Join us in June as we highlight Army Heritage Month and the team talks about the PCS season and how it impacts your health care. Stay healthy, Fort Novosel.